We begin with one of the most immediate viral threats, the resurgence of measles. Texas is currently experiencing its worst measles outbreak in over a decade. More than 540 confirmed cases have emerged, with clusters in areas with historically low vaccination rates. Tragically, among these, there have been deaths involving unvaccinated children. In parallel, Australia is witnessing its own battle with measles, with significant outbreaks reported across New South Wales and Victoria. Health officials stress that the root cause of these surges lies in declining immunization coverage, vaccine hesitancy, and misinformation. This serves as a reminder that diseases once thought to be nearly eradicated can return swiftly when collective immunity erodes. Turning now to the Southern Hemisphere, Queensland, Australia, faces a mounting crisis related to mosquito-borne illnesses. Dengue fever cases have almost doubled in the last year, and fatalities linked to Japanese encephalitis have been confirmed. Scientists attribute this spike to intensified rainfall and urban flooding, conditions that foster mosquito breeding grounds. The interplay between climate change and vector-borne diseases is becoming increasingly evident. In response, public health agencies are implementing mosquito control efforts and advising residents to use repellents, avoid standing water, and seek early medical care if symptoms arise. Shifting our focus to COVID-19, the virus continues to evolve with new variants. The LP.8.1 variant has become the dominant strain in the United States, now accounting for nearly two-thirds of cases. Though case numbers remain relatively stable overall, positivity rates are higher in the elderly, particularly those over the age of 85. There are also regional spikes, especially in densely populated urban areas. While hospitalizations remain manageable, the threat of immune escape and waning vaccine efficacy remains. Experts encourage the public to stay up to date with booster shots and mask in high-risk settings, particularly during seasonal surges. In Central Europe, foot and mouth disease is making headlines again. Hungary and Slovakia have reported major outbreaks among livestock populations, prompting mass culling and border closures for agricultural trade. This disease, though not a direct human threat, has significant implications for food security and economic stability. Initial investigations point to gaps in farm-level biosecurity, with suspicions also raised around illegal animal movements across borders. Officials are intensifying surveillance, and veterinary agencies are collaborating internationally to contain the spread. Meanwhile, other gastrointestinal viruses are causing concern. Ireland has reported a steep rise in norovirus cases, prompting several hospitals to restrict visitor access to contain transmission. This highly contagious virus spreads rapidly in communal settings, leading to vomiting, diarrhea, and dehydration. Healthcare workers are emphasizing hygiene, surface disinfection, and early isolation to prevent further spread. Additionally, the Oropouche virus, native to South America, has now been detected in travelers returning to the United States. This virus, spread by biting midges and mosquitoes, typically causes fever, rash, and joint pain. While not yet a widespread threat, its detection signals that global mobility continues to play a role in viral transmission patterns. Zooming out to the broader landscape, the World Health Organization has expressed concern over the state of global health infrastructure. Many low-income countries continue to face severe disruptions in healthcare delivery, stemming from funding gaps, supply chain breakdowns, and workforce shortages. Access to essential vaccines, antivirals, and diagnostics remains uneven. Meanwhile, in wealthier nations, there's growing fatigue around public health messaging and a decline in basic prevention habits, such as hand-washing and seasonal vaccinations. Experts warn that this combination, of vulnerability in some regions and complacency in others, could create conditions ripe for future pandemics. Public health leaders urge a renewed focus on prevention. Investment in vaccine innovation, global disease surveillance, and cross-border data sharing is more important than ever. Equally critical is rebuilding public trust through transparent communication and inclusive health education. As we conclude this briefing, let us remember that health threats are borderless, and our collective resilience depends on global cooperation, individual responsibility, and a commitment to science-based policy. Thank you for joining today's Infection Navigator. Stay informed, stay prepared, and take care of one another.